If you're worried about dementia, and let's be honest, if you clicked on this video, you probably are, then I need to tell you something that might actually change what you're looking for. Because you've been told the first signs are memory problems, forgetting names, losing things, getting lost. But that's not what I see first in my practice. What I see first is something completely different. Your nose, your drive, your words, your walk, your sleep. Most people are experiencing changes in these territories right now without connecting them to anything serious at all. If this lands for you, please subscribe to The Healthy Habit and turn on notifications. Because the patients who tell me they wish they'd heard this earlier, they wish they'd known what to actually pay attention to, and I don't want you to be one of them. I'm Dr. Gerald Mark, and in my practice I've noticed that the earliest warning signs of dementia almost never announce themselves the way people expect. Here's what gets missed every single day. You wake up, you make your coffee, you smell it, and you think, somewhere in the back of your mind, that it doesn't quite have the richness it used to. Your spouse mentions you've been quiet lately, that you don't seem as interested in things. You brush it off. That night, your partner says something about you moving strangely in your sleep, more restless. You laugh it off. 3 separate moments, 3 separate changes, and because they're scattered across different parts of your life, nobody connects them. A study in Neurology followed nearly 2,800 people without cognitive problems for 5 years. What the researchers found genuinely changed how I approach this. The people who developed problems later didn't just have early memory changes. They had changes in completely different places: smell, motivation, movement, sleep. I want to tell you about a patient named Peter. He was 72, retired accountant, came in with his wife Susan. Peter insisted he was fine, not forgetting appointments, not getting lost. But Susan had been watching something change for almost 2 years. He used to play golf every Saturday morning. That was his thing. One morning he just didn't want to go. And then he never went again. Not because something bad happened. He just lost the desire. His garden, he'd been out there every morning for decades. Suddenly he didn't care about it. He'd walk past it now, like it was something on someone else's property. And recently, Susan mentioned something else. He was moving differently, slower, more careful, like he was thinking about each step instead of just walking. And at night, this was the thing that worried her most. He was acting out his dreams, kicking sometimes. Once he shouted so loud it woke her up. Peter sat there and said, "I feel completely normal." And here's the hard part. He did. He wasn't experiencing any distress. But something was changing, and Susan was seeing it before anyone else because she lived with him every day. I asked Susan that day, "Have you thought about keeping track of these things?" And she said, "Doctor, I have a note app on my phone. I've been doing that for 6 months. I was afraid I'd forget what I was seeing." End quote. That moment, when she showed me that phone, that's when I knew this was serious. Because Susan was living with mystery and trying to document it so she wouldn't lose the thread. We ran some tests on Peter. We didn't find obvious memory loss, but what we found was early change in areas connected to motivation, movement, and sleep. Peter didn't have a dementia diagnosis, but he had mild cognitive impairment, and we caught it because we were looking in the right places. You're in the kitchen, you pour the coffee, you bring it to your nose, and something's off. Not completely gone, just muted. The perfume your spouse wears isn't as strong. Cut grass doesn't come through like it used to. You think your nose is aging. Now, here's what matters medically. The nerve that carries smell signals goes directly into one of the memory centers of your brain, the entorhinal cortex, which sits right next to your hippocampus. Those are some of the very first places affected in Alzheimer's disease. When those brain cells start struggling, one of the earliest things that changes isn't memory. It's the ability to identify smells. Researchers test this in clinics. They ask people to identify familiar scents: peppermint, coffee, roses, cinnamon. A study in laryngoscope found that people who got worse at identifying smells were significantly more likely to develop cognitive problems years later. So if your sense of smell has clearly changed, mention it to your doctor. Sometimes your nose notices things in your brain before your memory does. When I asked Peter about his sense of smell, Susan answered. She said, "Yes, He keeps saying food doesn't taste like it should. This one breaks my heart every time I see it. There's a person you know, maybe it's you, who used to care about something. Really care. The grandkids they'd call every Sunday. The hobbies, the friends, the things that made them light up. And then one day, it just stops. Not because something happened. They just lost interest. In medicine, we call this apathy. And it's one of the most common early features of dementia, particularly Alzheimer's. Studies in JAMA psychiatry have shown that new-onset apathy in later life, especially without a history of depression, is associated with mild behavioral impairment, and that marks an increased risk of future dementia. Here's what makes this so hard to catch. The person experiencing it doesn't feel bad. Depression makes you feel awful. Apathy is different. You don't feel sad about your golf. You don't feel guilty about the garden. You feel nothing. And because there's no distress, people don't seek help. But the people around them notice immediately. If someone close to you has said more than once that you've lost your spark, that you're not yourself anymore, listen to them. That observation might be worth more than any test I could order. Susan said it clearly. He's just not him anymore. And Peter genuinely couldn't understand what she meant. But something was changing. And I wonder, as I'm telling you this, whether someone in your life has already said something like this to you, and you brushed it off. Drop a comment if that's resonating. You're mid-sentence and the word is right there. You can almost see it, but it won't come out. So you talk around it. You say, the thing you use to cut the bread with. Everyone nods. You move on. You think it's just aging. And usually, yes, it is. Losing a word here and there is normal. But here's what I watch for. It's not the occasional blank. It's when the blanks start connecting, when they form a pattern. I saw a man recently, mid-sentence, and he just stopped. Looked down, started clicking his fingers, shook his head. It's gone, he said. Words. He kept losing them, but then his wife mentioned something else. She said he'd started replacing words instead of searching for them. The microwave was the food heater. The remote control was the telly thing. Not once. Every time. And here's the crucial part. He didn't notice he'd done it. When you notice you can't find a word, that's normal frustration. When people around you start noticing your sentences have changed, that's different. A study in Neurology found that decline in verbal fluency predicted cognitive impairment years before formal diagnosis. Here's something I actually use in clinic. Pause the video if you want. Name as many animals as you can in 60 seconds. Any animals. Go. Most people over 60 get between 15 and 20. If you got above 12, that's reassuring. If you stuck after 7 or 8, that's worth mentioning to your doctor. The word-finding thing is tricky because everyone does it. The question isn't whether it happens. The question is whether it's new, whether it's getting worse, whether other people have started noticing. That's your filter. You hear someone walk across a room, and before you even look, you know who it is. Not by looking, just by listening. That rhythm, the timing, that's your motor signature. It's like a fingerprint of how you move. Your brain does an enormous amount of work to keep that coordinated, and when the wiring gets damaged, you can see it in how someone moves. I saw a 70-year-old man recently. No pain, no limp, nothing obvious, but he was slower crossing at traffic lights, more cautious. On its own, that could be arthritis or his back. But here's the test that catches my attention. I ask him to walk down the corridor. Fine, normal. Then I ask him to walk down the corridor and count backwards from 107s, and he stops. Not because he can't do the math, because his brain can't do both things at the same time anymore. That's dual task interference, and it often appears 10 to 15 years before a dementia diagnosis, when walking becomes something your brain has to think about instead of just doing automatically. That tells me the spare capacity is shrinking. Susan had mentioned this about Peter. She said he was moving more cautiously now, especially when crossing streets. Like his confidence had shifted. She'd started walking next to him instead of ahead of him, without either of them talking about it. Last one. When I describe this, some of you will turn to your partner and say, "That's him." It's called REM sleep behavior disorder. It means you're acting out your dreams. Normally when you dream, your body is paralyzed. Your brain switches off the muscles, so you can dream about running without actually getting up and running. In REM sleep behavior disorder, that switch breaks. So you do move. You shout. You punch. You kick. You might throw yourself out of bed. You wake up with no idea what happened. But your partner knows. They've probably been sleeping with one eye open for months. Here's why this matters. This isn't just a sleep problem. REM sleep behavior disorder is one of the strongest early markers we have for Lewy body dementia. And it can appear years, sometimes a decade, before any cognitive symptoms show up. A study in the Lancet Neurology found that over 80% of people with this disorder went on to develop a neurodegenerative condition. This gives you a real window. If your partner has told you that you're thrashing about in your sleep, that you're shouting, that you've kicked them during the night, don't brush it off. Mention it to your doctor. That's a sign worth knowing about. When I asked Peter about his sleep, Susan answered before he could. She said he'd been acting out his dreams for at least a year, sometimes violently. That was the sign that made me take everything else very seriously. I'll be honest with you, I've missed this sign before in a patient. Not completely, but I didn't push hard enough on it, and I think about that. I think about what might have changed if we'd caught it sooner. So when Susan mentioned it, I listened differently, and that made all the difference for Peter. Here's what I've put together working with patients on exactly this. Something I call the 5-territory check. The 5 territories. Smell. Has it noticeably changed? Drive. Have you lost interest in things you used to love? Words. Are you having more trouble finding them? Walk. Have you changed how you move? Sleep. Are you acting out your dreams? One of these in isolation is almost certainly nothing. But if you've noticed 2 or more, and they're new, and the people around you have mentioned them too, that's something worth bringing to your doctor. Here's what I want you to do this week. First, have one honest conversation with someone you trust. Your spouse, an adult child. Ask them directly if they've noticed any changes in you. In your energy, in your interests, in how you move, in how you seem mentally. Don't dismiss what they tell you. They're seeing you from the outside. That perspective is real. Second, when you see your doctor, don't go in worried and vague. Go in specific. Bring the 5 territories with you. Say, I've noticed my sense of smell has changed. Or, I've lost interest in things I used to love. Or, my partner says I'm acting out my dreams. Specificity changes how seriously doctors take things. That's it. Those 2 things. Because what you're looking for is early detection. And early detection doesn't mean bad news. It means options. It means time. It means a fighting chance. Your sense of smell is controlled by an area of the brain that dementia often hits first. Loss of motivation, that apathy, that sometimes early brain change that shows up in the people around you before any test. Difficulty finding words, slower fluency, that's not just normal aging. Changes in how you walk, that's your brain telling you something. And REM sleep behavior disorder, thrashing in your sleep, that's one of the strongest early markers we have, appearing a decade before other symptoms. Peter came in thinking everything was fine, but Susan had been watching. She'd been documenting it on her phone because she was terrified of losing the thread. And because we listened to her, because we believed what she was telling us, we caught something early. That's not bad news. That's exactly when you want to catch it. You watched all the way through this video, and that means you're paying attention to something most people around you will never pay attention to. That's not paranoia. That's intelligence. That's how you protect yourself and the people who depend on you. You came in here not knowing what early dementia actually looks like. You're leaving knowing 5 specific, observable territories that can shift years before memory loss becomes obvious. That genuinely changes how you see your own daily life starting today. You now know that if you notice one of these changes, it's not paranoia to bring it to your doctor. It's smart medicine. You've given yourself options and time. If you've recognized anything in this video, share it with someone you love. Not to scare them, to protect them. Because catching something early changes everything. Subscribe to The Healthy Habit if you haven't already. Because this is the kind of information that used to require a doctor in your family to have access to. Now you do. And the last thing I want to leave you with. This week, have that one conversation with someone you trust. Don't wait. Just pick one of these 5 territories and ask. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.